Hi everyone. My technique demonstration presentation is going to be on grounding techniques. Grounding techniques are commonly used in the treatment field a lot of the time because a lot of the clients that come in have suffered from trauma. They are not feeling confident or safe in their bodies. There's a lot of emotional flooding happening based upon their usage. A lot of clients come in when they're quote unquote in their heads. They're not able to stop thinking about all of the things that they've done while they're using. So grounding techniques are something that we use commonly in the field. So what is grounding and the purpose of grounding? A lot of the time when we use grounding, it's to distract or prevent the client from being triggered or emotionally overwhelmed or having them go through a disassociative state. We do get clients that have significant trauma that do come in that are currently in that dissociative state. Grounding techniques can be subtle and they can be used frequently as needed without other people being aware that you're using this technique. That's why grounding techniques are really great, because you don't have to be in that clinical setting. If you're at the mall and you're starting to become overwhelmed, you can use some of these techniques without others noticing them. Although some rely on these sensory experiences, you may utilize non-sensory techniques to redirect attention. They can be oriented to the client and allow them to achieve a healthy medium between completely shutting off emotionally and becoming emotionally overwhelmed. It allows the client to stay in the present moment instead of reverting back to flashbacks or memories of things that their trauma had led to them. So who would benefit from grounding? So people who experience extreme levels of emotion. For example, we have clients come in a lot of the time who, like I said, are feeling really upset of all the lies and the deceit and the things that they've done to their families, to themselves, the things that they've done in order to get drugs. So they can escalate into really emotional states. Clients that are prone to disassociation, clients that have experienced an excessive amount of trauma, and begin to have like out-of-body experiences, almost like dream state. Clients who struggle with addiction, and it doesn't have to be drugs or alcohol. Gambling or shopping is an addiction. Clients who suffer from anxiety or panic disorders, suffer from anger management or rage. Clients that become extremely enraged. This is a great technique. PTSD is also another type of client that would benefit from this grounding, or someone that engages in self-harm, such as cutting or burning. So there's 4 types of grounding. That's mental grounding, reorientation, sensory, and movement. And I'm going to go through each technique and kind of just highlight some of the clients that would benefit and what that means. So mental grounding techniques are used to bring awareness to internal stimuli for clients who struggle with paying attention to sensations in their body. Clients that would benefit from this type of therapy or intervention would be clients who have experienced sexual trauma. They've struggled with sexual abuse, physical abuse. They just don't feel safe in their bodies. It's a way for the clients who feel too much internally to take the attention away from their bodies. So reorientation grounding are techniques to orient the client to person, place, and time. If the client is experiencing that emotional flooding, they come in to your office and they are just completely overwhelmed. They're experiencing flashbacks. An assessment that can be used to decide if this is appropriate is a SUDS scale. So SUDS is when the therapist would ask the client to describe their emotional flooding on a scale of 1 to 10. We often use this with our clients because if you have a client come in and say, okay, I'm at a level 7 as far as how emotional I feel, you want to get that client down to a 3 or lower because if they're any higher than a 3, they could re-traumatize themselves. Sensory grounding techniques are used to help the clients become aware of their senses in order to bring their attention to the present moment. This is an example of a client is in their head. That's often a term used in substance abuse. You know, a client can just constantly be thinking and not be present with their body. You know, a client that has racing thoughts, frequently worrying, somebody who suffers from panic attacks or anxiety, this would be helpful for. So movement grounding techniques is the last technique, and this technique is used to get the client's mind, the body, in motion to bring their awareness back to the present moment and in their body. It's most helpful for clients who suffer from frequent dissociation states, another association with trauma, clients that tend to go in and out of awareness. Forcing the client to move from their bodies and become aware.